This patient we did implant in 2015. This X-ray is taken in 2019, almost 4 years later. It's a GenXT compressive implant used for replacing left lower molars. We can see the buccolingual cross section here. This is the mesial most implant. Mostly 3.5 into 10 mm implant. This is also 3.5 into 10. Placed close to the lingual plate, but not perforated. This is distally tilted, the distal most implant. No lingual cortical engagement. So patient came again later after few years in 2022, almost like 7 years, 6 to 7 years follow-up. The bone level is healthy. There is no crystal bone loss. It's well osseointegrated and functioning good.